Why do Native Hawaiians experience so much health disparity? Short answer, colonization. Ano ai ke aloha kako and welcome back to Iola no Lāhui, Decolonizing HIV care. For so many of us Kanaka, it's normal to have family with heart problems or with diabetes or with cancer, and to a lesser known extent, many of our people live with HIV. The conditions that exacerbate health disparities in heart disease or diabetes, for example, are the same that lead to poor health outcomes in HIV and AIDS experiences among Kanaka Maoli. Enter the most obvious of the social determinants of health, healthcare quality and access. Mauliola, or health and vitality, depends on the kinds of healthcare we have access to. Historically, it was the sugar plantations providing healthcare and welfare programs to its employees, the ranks of which were filled with immigrants. Kanaka who managed to retain their ancestral and kuleana lands were few and far between, left to tend their plots with resources that were often diverted to support large industries. We are fortunate in some ways that the state of Hawaii has had progressive healthcare laws for many decades. In 1978, well before the Affordable Care Act, the state of Hawaii required employers to provide healthcare coverage to employees who work 20 hours or more a week for 4 consecutive weeks. We were among the first states to expand Medicaid, and in the world of HIV care and prevention, we are among the most progressive. We cover HIV meds completely, regardless of healthcare coverage and immigration status. We are also a non-disclosure state and adhere to very strict confidentiality laws that are even more stringent than HIPAA. We even allow minors aged 14 and up to consent to HIV treatment and prevention options, which protects the most vulnerable among us who cannot share their HIV diagnosis or risk factors with their parents. But then that begs the question, if we have such progressive laws and policies, where did it all go wrong? It all boils down to the availability of quality healthcare and access to that healthcare. We know that insurance is the gateway, or sometimes gatekeeper, to healthcare. We must have health insurance if we want to be successful in addressing health disparities. In the next segment, we're going to use an equity lens to uncover our challenges and hopefully see where our resources will be better utilized. Take good care. Ahui ho kako, Iola no Lāhui. Today's segment is filmed here at Kaka'ako Waterfront Park. This is the site of Honolulu's first Hansen's disease hospital and where patients were shipped out to Kalaupapa, where they were exiled for the rest of their lives. Our relationship with this dark chapter of our history is complicated. It was a time of great strife, but of profound resilience which offers much hope to our people, especially those living with HIV. This brutal public health policy is a powerful lesson in the role of stigma, a lesson we must be willing to learn from if we hope to make real change.